Hey everybody, I wanted to talk about something a little bit different today. So I get messages of people asking me, hey, what medications are you on? Were you able to taper off all of them? And so today I want to talk about something that's called low dose naltrexone. So I don't think I've made a video on this yet. I haven't talked about this yet, but something that I tried last year. This is 2022 now, so something I tried actually at the end of 2020. I actually started trying it. It's called low dose naltrexone. It is something that you have to get in prescription form, so you have to have a doctor prescribe it. And let me explain a little bit about it. So how it came across to me is a friend contacted me and said, hey, I think low dose naltrexone might help you. Check into it. So I just started reading up on it. Now, naltrexone is something that's used for alcoholism. If you're struggling with not drinking or having issues with alcoholism, naltrexone is something that they will prescribe to you so that when you're taking it, if you happen to drink, it will make you very ill and you won't want to keep drinking while you're taking it. That's traditionally how it was used and what it was made for. Now, naltrexone at the original dose is for alcoholism. However, there are some studies out there, and I will link them in the description, for very low doses. This is why it's called low dose naltrexone, and it's being tried on autoimmune patients. So what happens is they figured out that very low doses of naltrexone, and by low doses, I mean I am taking 4.5 milligrams, a very low dose. For alcoholism, you would take 50 milligrams, and I'm talking about 4.5. So it's a very small dose. You actually have to get this compounded at a compounding pharmacy because it's such a small dose. So what happened is I read all about it. I read the studies and I wanted to try it. So I actually went to my primary care physician and asked him, had he ever prescribed it? And did he know anything about it? Now, he only knew it as a drug for alcoholism. So he's like, you only get it if you're an alcoholic. You don't get it for autoimmune. And I was like, no, there are autoimmune studies out, not a lot, but a few, and they're small, very small studies. They're not huge by any means, but they are having some success, and they're continuing to study naltrexone at very low doses for autoimmune. And he was like, bring me those studies. I'll read them and get back to you. So what I did was I printed out 2 successful studies that I had read about where they were using naltrexone, and it did discuss what dose they were using. So I was like, okay, this should be helpful. So I brought it to him and he said, give me a day. I will for real read this and then give you what I think. So I said, okay. So he actually called me back the next day and said, I'm willing to give this a try. You will be the first person that I prescribe this to. I've never prescribed it for autoimmune at this dose. So you'll be the first one, and I'm going to give it a try. That's how I got my primary care to prescribe it. He had not heard about it. He wasn't promoting it. He wasn't talking about it, but he did read the study and then was on board to at least try. He's like, we'll give it a try. If you don't like it or it doesn't work for you, that's it. We won't try it anymore. Now, it is a prescription and it is compounded. So you do have to get it from a compounding pharmacy. So the thing is, it is a drug, it is prescribed, but the side effects for me were so small or minute that I was willing to give it a try. So there comes a time with chronic illness where we hit a part in our life where we are so sick and so tired of being sick, we're almost willing to try anything, which is why I've tried so many supplements and so many things, because I want to get better no matter what. That was where I was at when I tried low dose naltrexone. I was at the point of no return where I thought, all I'm doing is getting worse and worse every single year. I was continuing to go downhill. What's the harm in trying this? It wasn't a drug with huge side effects like the other drugs were. So the side effects were not losing your hair. It was not losing all of your energy like the other drugs they wanted me to try. So I felt like it was doable for me. It was a small price to pay when I read the side effects, and I was willing to give it a try. It was probably a drug with the least amount of side effects I've seen that they had asked me to try. So why not at this point? I had nothing to lose. So I actually had it prescribed, went to go pick it at the compounding pharmacy, and was surprised for the pharmacist to actually give me more instructions on how to take it than the actual doctor. So she was prescribing it. She was talking to the people that she was prescribing it to, and she was learning how to do, how people were doing on the drug, and was able to give me some advice. And some of the best advice she gave me was, this is a hard drug to taper onto. That it's not hard in the sense that really bad things happen to you. It's just hard to get your body used to taking it, and you start in very small doses. Now, for alcoholism, the very high dose, you don't start at very low doses. You go on the max dose right away. But with small doses, which is why it's called low dose naltrexone, you start at such small doses that, because it modulates our immune system, we have to go on it slowly. And that can be a little scary just hearing that, because I was like, oh, what's going to happen? What is it going to do? But I was so sick that I was willing to just go for it and see what happens. I had nothing to lose at that point. So she was probably the pharmacist. She told me that in my city, 50 to 60 people she was prescribing it for, and that they were doing really, really well. And the best piece of advice she gave me was to take it slow and not to become discouraged, because she had 50 or 60 people successfully using low dose naltrexone, that they were doing very well with their autoimmune conditions. And that for me not to get discouraged, because it's not something you take one day and the next day you wake up feeling great. It's actually a small buildup to it. I was taking small doses, smaller than the 4.5. I was taking it and taking half doses at first, and then working my way up slowly. Now, I was a little worried to try it, because everyone kept telling me, because your autoimmune system isn't working correctly, if you take anything that modulates the immune system, helps it work better, you're going to become sicker. My own specialist was telling me this. If you take anything that modulates your immune system, you're going to attack your joints more. It's going to turn up the volume on everything wrong that's happening. Now, I believed it when they told me that. I had no idea to believe otherwise. So I was a little bit scared to try it. But like I said, when you're chronically ill, you get into a space where you're willing to almost try anything that might give a little bit of relief. And this happened to be at that point for me. So I was willing to give it a try. The specialist would not go for any type of prescription like this. But the primary care was like, hey, the side effects are so negligible that I don't see why you can't at least see if you're a candidate for this medication. So that's how it all got started. That's how I started it. It honestly took me a good 6 months to get to a full 4.5 milligrams dose. But slowly but surely, I started to feel benefits from it. And I'm still taking it to this day. So what are the few things that I felt it was doing for me? Is one, it gave me more energy. Two, at the time I started low dose naltrexone, I was having 2 lupus flares a week, and I was sick about 4 days out of every 7. That's the spot that I was in when I started taking low dose naltrexone. Now, it took me forever to get up to the proper dose, but once I did, even the very small doses, I noticed I had more energy. And also those flares that I was having 2 times a week tapered way down. So what happened is I would still have a flare, but instead of lasting 2 days, it was only lasting like a few hours or that one day. And then the next day I would recover. So what it did originally was cut the times that I was having flares in half. So instead of being sick 4 days out of the 7, I was only sick 2 days out of the 7. To me, that was a win-win situation. There was nothing better than what was going on. So there are groups on Facebook that are people that are on low dose naltrexone, and they tell you their stories and what it has helped them accomplish. Some autoimmune patients get on low dose naltrexone and it turns everything around. They're living their best life. I didn't happen to be that person, which is okay. I've never been able to be that person, but it did help me cut my flares in half. The days that I was sick became less. So I was okay with that. It did give me more energy. Now I would still have a flare and I was still having issues walking, more than a quarter of a mile or anything like that. But in the beginning, when I started taking it, I did feel a lot of benefits from it. Just the added energy and being able to cut my lupus flare days down was enough of a benefit for me. Now, I will warn you that when you go see another medical professional that doesn't understand low dose naltrexone, when you put that low dose naltrexone on the paperwork of a drug that you're taking, they will assume that you're an alcoholic. They have assumed I'm an alcoholic every time. So now I realized that these doctors do not realize you can use it for autoimmune. So now I say low dose naltrexone. And by the way, I'm not an alcoholic. I'm using low dose for autoimmune conditions. And then they're shocked. They're like, really? What is it doing for you? What are you doing with it? Now, originally, naltrexone was for alcoholism at much higher doses than what we're taking for autoimmune. To get my doctor to prescribe it, he had to read a study, and I'll link the study in the description. I printed it out and let him read it, and he did allow me to try it, and I was his first patient that he ever prescribed it for. So it was a win-win situation. I hope that he's prescribing it to others now, and that he's allowing others to try this medication. It has been nothing but a blessing for me. Now, it didn't fully turn my autoimmune around like it did some of the people that I read about. I've been in contact with some people that turned everything around for them. Now, that wasn't the case for me, but it did give me enough of a benefit that it was a positive thing to add in my arsenal of things that I need to take every day. I continue to take it to this day. The benefits outweigh any of the side effects. And oddly enough, I'm the type of person that I can take any type of drug, and if there's a side effect, that side effect happens to me. In fact, even other side effects will happen that no one even knew existed for that drug, because that's just how broken down my body was at the time. But this particular drug, low dose naltrexone, I had hardly any of the side effects. And the side effects were stuff like stomach upset, or sometimes I felt a little bit of anxiety from it, or even a little bit of depression. When I was trying to titrate up in my dose, I did feel a little bit of depression sometimes, and that just meant I had to titrate back down to where I was before I titrated up, and then give it another 2 weeks and then try to titrate up again. So it was a drug that I slowly began to tolerate, but the side effects were not things like you lose all of your energy, or all of your hair falls out, or any of the other side effects that we're used to with all of the other drugs. This is not the typical drug. This is something that was easy for me to try, and the side effects were so negligible that I was willing to give it a shot. There are other drugs that they've asked me to try for autoimmune that I have refused, because I read the side effects and was terrified to try it, because I knew how my body was with side effects. If there was a side effect, I would have it. So with low dose naltrexone, you have to be aware doctors don't prescribe it, and they don't know what it is for the most part. You might have a doctor that understands it and is willing to work with it, or you might have to send them studies and slowly get them used to the idea of you trying it out. It is something that, if you haven't heard about, I encourage you to read more about it. It is a very encouraging drug. And it is not your typical full effect, crazy side effects. It's not the typical pharmaceutical where they make lots and lots of money off of it. In fact, it is something they don't make money off of. And so you're not going to hear about it, honestly, unless you seek it out. It is not something a doctor is going to recommend, at least for the most part, not for me. They didn't recommend it at all. I actually just had to find out about it. So I encourage you to just start reading about it and see if it's something that you're willing to try. I don't know if you're in the place that I was in at the time I tried it. I was at a very low point with my chronic illness. And so it was something that was a blessing for me to try. And it was something that did help me. I did gain energy from it. It did cut my flares in half, like I said. So I'm hoping that if you see this and it's something that you're encouraged to read about, if you try it, let me know. Or if you want more information about it, let me know. It's something that has helped a great deal. In fact, I'm still on it to this day. I started it at the end of 2020. So, and it took me half of 2021 to really kind of tirade all the way onto it. It took me about 4 to 6 weeks, months to get up to the full dose and then feel comfortable on it and well every single day. But right away, it did cut my flares in half, even at the very small dose. So where did naltrexone come from? Like I said, it was originally invented for alcoholism. However, during years and years ago, during the AIDS epidemic, they started doing studies on low doses and realized it was actually modulating the immune system. And that's where some of the studies started to come from. So like I said, in the description, I'll link some of the studies so that you can learn more about it and decide if it's something that will help you along in your journey. I know it certainly has helped me, and it's something that I wanted to talk to you about in case, because like I said, you're probably not going to hear about this from your doctor. It's not something that makes the system a whole bunch of money. In fact, they make no money off of it whatsoever. So it's something that I had to pursue on my own and then get my doctor to read about it and then encourage him to write a prescription. And I was the first one he ever wrote a prescription for. But he was willing to give it a try after reading the study. So I'll link the studies in the description. If this has helped you in any way, let me know. If you want to know more about how I got on it or how I was able to tolerate it or what I did, let me know and I'll shoot you guys a video for it. As always, I hope you're doing well and I'll see you guys in the next video.